Disease overview. Signs and symptoms. The incubation period for foodborne botulism is usually 12 to 36 hours but may range from a few hours to 10 days. Fever might occur after a secondary infection, e.g., aspiration pneumonia. The progression of illness is similar among patients with different types of botulism. Foodborne. Wound. Inhalational. Except that foodborne botulism patients often experience gastrointestinal symptoms such as nausea, vomiting, and diarrhea that precede the onset of neurologic illness. The typical neurologic presentation of botulism is asymmetric. Same on both sides of the body. Descending flaccid paralysis that begins in the nerves that control the muscles in the face, head, and neck, cranial nerves, and progresses to include proximal muscle groups such as hip and shoulder muscles and then distal extremity muscle groups such as muscles of wrists, hands, and feet. Some patients also experience abdominal pain or cramping, constipation or ileus, paralytic obstruction of the intestines, and urinary retention. Causes. Foodborne botulism is the result of ingestion and absorption of toxin that is produced by botulinum and contaminated foods. Unlike foodborne and wound botulism, infant botulism and adult intestinal colonization botulism result from ingestion of the bacterial spores that grow and produce botulinum toxin within the large intestine. Affected populations. Infant botulism occurs globally and is the most common form of human botulism in the United States. Patients diagnosed with botulism demonstrated a predominance of toxin type A west of the Rocky Mountains and type B east of the Rocky Mountains, while type E is more prevalent in the Pacific Northwest, Alaska and the Great Lakes area. Disorders with similar symptoms. Lambert-Eaton myasthenic syndrome is a neuromuscular disorder that may be an autoimmune disease. Other symptoms may include dryness of the mouth, impotence, pain in the thighs, and a pricking, tingling or creeping sensation on the skin. Paresthesias around the affected areas. Guillain-Barré syndrome, acute idiopathic polyneuritis, is a rare, rapidly progressive disorder resulting from inflammation of the nerves, polyneuritis, and resulting in paralysis, damage to the covering of nerve cells, myelin, and nerve axons, the extension of the nerve cell that conducts impulses away from the nerve cell body, results in delayed nerve signal transmission. Myasthenia gravis is a chronic neuromuscular disease characterized by weakness and abnormally rapid fatigue of muscles, particularly those that are controlled by the brainstem. Bulbar innervated. The symptoms of myasthenia gravis typically improve following a period of rest. Diagnosis. The clinical diagnosis of botulism may be made based upon a thorough clinical evaluation and a detailed patient history. The mouse bioassay and mass spectrometry-based testing, EndoPEP-MS, are the gold standard methods for laboratory confirmation of the clinical diagnosis and may demonstrate the presence of botulinum toxin in serum, gastric fluid, stool, mouse bioassay testing only, or foodborne botulism specimens. Prevention. The following link provides information about proper techniques for canning. http://nchfp.uga.edu/how/can_home.html. Clostridium botulinum spores are highly resistant to heat and may survive for several hours at temperatures of 100 C. Exposure to heat at 120 C destroys C. botulinum spores. In contrast to spores, botulinum toxin is easily inactivated by heat. Thus, thoroughly heating food at 85 C or boiling may inactivate toxin. Treatment. Since respiratory impairment and its complications may be life-threatening, affected individuals should be hospitalized, closely supervised, and promptly treated with antitoxin. Health departments may then contact Centers for Disease Control and Prevention, CDC, to discuss appropriate testing and treatment of suspected patients. Thank you for watching. Please subscribe for more videos. Your like, comment, and share always motivate us.